AMCAL conducted a sleep health survey at the end of 2018, and we found that almost 3/4 of Australians are admitted to having poor night's sleep. So it's very normal to experience a bad night's sleep, and there's lots of things that you can do to tackle it. We also found about 2/3 of Australians were ignoring some warning signs that their lack of sleep is at a risky level, so it is affecting their health. So if you do have a bad night's sleep, don't just brush it off. Approach your AMCAL pharmacist or your GP and ask what kinds of things you can do to achieve a better night's sleep. There's lots of really accessible things, whether it's something as simple as looking at your sleeping environment, making sure it's the right darkness, the right temperature, making sure you don't have too many screens right before you go to bed, things like that that are quite simple, to maybe having a consultation with your pharmacist or your doctor about whether there might be a chronic condition that's causing you to have a bad sleep. For example, sleep apnea or other issues that might mean that you're having a bad night's sleep, but that can be easily treated with something like CPAP therapy or other options. Benzodiazepines are a commonly prescribed medication for sleep. They do help basically calm the brain down so that you can get a little bit of rest, and they do make you a little bit drowsy. They can be useful in short-term scenarios, so if there's a short-term reason why you might be losing sleep. The downside of using benzodiazepines and some other sleep medicines is that oftentimes your body can get used to them, and then each time you use them you might find that you need a little bit of a higher dose to achieve the same effect. But in getting that effect, you will also get more side effects such as slower breathing and increased drowsiness. So they might become less effective for you and more risky for you as you take a higher and higher dose. If you or a loved one are struggling to get a good night's sleep, you can see your AMCAL pharmacist for a sleep health check. And you can download the Sleep Medication Action Plan from scriptwise.org.au.